Okay, so welcome to everyone who is joining us for a really important topic today on public health. We are going to be talking about well-being through education, career, and involvement. My name is Laura Timmons, and I am the Dean for Nursing and Healthcare with Gateway Community College. I'm so excited about this topic, one, because my master's degree is in public health, and it's just such a vital component of everything that is happening today. My background is in exercise physiology, public health, and health professions education. We have two wonderful guests with us with diverse backgrounds to bring the conversation to light. And I'm really excited to get this started. So just a couple of housekeeping notes. First, we want to thank the League of Innovation for their grant and support with this initiative to get this information out. A couple of housekeeping notes is everybody who is attending is on mute with no video. But if you have a question or a problem, please type that in the Q&A chat so that that is being monitored, because we do want this to be an interactive session, and we do encourage participation and questions. So if you could type those into the chat anytime as you get them, I will pull them into the conversation once our presenters are done. And again, it's going to be a very casual format. We're going to go back and forth between our guest speakers. We're going to monitor that chat, and hopefully we're going to get some really good information out there. So I am going to throw this over to Sophie to introduce herself, and we'll get going. Thank you.
Hi, I'm Sophie Bowerman. I have been a nurse for, well over 20 years, and I currently am involved in women's education at a large institution in Chicago, a teaching hospital at Northwestern, and I'm an adjunct professor at Roosevelt University, one of my favorite classes being community health that I teach. I feel so strongly that students can get involved in all different kinds of opportunities throughout their education that can actually have an impact on public health and expose them to all different kinds of opportunities. So it's something I'm very passionate about, and thank you very much for having me here today. I'm excited to discuss this with Leah as well. So.
Hi, good afternoon, everyone. My name is Leah Hill, and I work for a local employer within the Phoenix area. And rather than representing that employer, which I'll talk about in a minute, I am not only representing the employer, but also I am a certified career coach and nationally certified workforce development professional. And being within the healthcare industry for a little over 20 years now, believe it or not, there is an intersection between, in my opinion, workforce development, healthcare, and business, healthcare as a business. So I'd like to spend some time talking about that with all of you later today, and I'm sure that'll be infused into my responses. But I think that we're in for an action-packed 2 hours together, so I'm looking forward to, again, discussing with Sophie. I appreciate the opportunity as well for being here, but also I look forward to hearing from the audience members as to your questions and inquiries surrounding the intersection of healthcare, workforce development, public health, and all of our current events that are also going on as well. So on that note, I think we're going to share a brief video as to what public health is. If that's okay with Laura, we can go ahead and I don't have the ability to share just yet, but this will kind of set the tone as to what public health is. And Sophie, Laura, please give me a thumbs up or thumbs down if the audio is enabled, and that way I won't make everyone sit through a 3-hour read lip session, or 3 minute, excuse me.
Public health is a vaccine that prevents disease.
Public health is a scientist who discovers the source of a salmonella outbreak.
Public health is outreach that helps prevent tobacco and drug use.
So what is public health? While a doctor treats individuals, public health looks at the health of a community. We research the risk of disease and injury in a population and take action to prevent them before they occur. Our early successes help stop the spread of infectious diseases by improving housing and sanitation. With a greater scientific understanding of health, well-being, and equity, We introduced prevention and early detection activities that help increase life expectancy by more than 20 years.
Public health is access to prenatal services for healthy babies and moms.
Public health is safety advances like seatbelt laws that have saved millions of lives.
Public health is access to contraception and education to prevent sexually transmitted diseases.
Public health was founded on the principle of social justice. As a basic right, everyone should have the opportunity for good health. But today, improvements in life expectancy have slowed, and we do not live as long as people in many other countries. Did you know? Only a small amount of what affects our health actually happens in the doctor's office. In fact, our health is mostly determined by the social and physical environments in which we live, learn, work, and play. Forget genetic code. A zip code can mean a difference in 15 or more years in life expectancy, even if you live a few miles apart. Nearly half of Americans live in communities with unhealthy levels of air pollution. The Flint, Michigan lead crisis taught us the dangers of our aging water system. Poverty and poor health go hand in hand. Too many workers are denied a livable wage. They can't escape poverty and their health suffers. On-time high school graduation is a leading indicator of good health, but more than 20% of students miss this opportunity. Too many neighborhoods lack healthy, affordable food options like fresh fruits and vegetables. Addressing these complex health challenges require cooperation across many sectors. Thankfully, public health has taken the lead in working with government, community organizations, and business.
We partner with city planners to design safe communities that encourage physical activity, bike paths, public transportation, and parks.
We support Medicare, Medicaid, CHIP, and the Affordable Care Act as steps to quality and affordable health care.
We advocate common sense measures to reduce gun violence. We can reduce gun deaths in the same way. We partnered with road planners and car engineers to address auto fatality.
So what is public health? It is all of us. Working together to make sure our communities are safe, prevent disease and injury, and give everyone the opportunity for good health. Join with APHA. We create the healthiest nation in one generation.
So as you all can see, public health is very diverse in its areas. It is, some say social justice, some say that it's just a human right, some say it's a way that paves a pathway into greater health outcomes for all individuals. There's a brief presentation that I'd like to share with all of you in regards to how I see the intersection of public health and workforce development. So I'll go ahead and share that briefly with all of you now. So I thought this background was appropriate only because it kind of interweaves, in my opinion, not only public health through education, career, and involvement, but again, like I mentioned, I'm going to take it a little further step and talk about the healthcare workforce, especially for those of you who are participating within this event, whether you be students or alumni or even faculty or staff. You may be involved within the healthcare community or aspiring to become members of the healthcare community. So I kind of wanted to take my own personal spin as to how I see all of those roads intersecting into one. So just briefly, a little bit about my background. Like I mentioned, I am a healthcare employee of almost 20 years, but healthcare is a business, and I personally have a passion for education as well. I do realize that there are other non-linear routes into career and prosperity. However, that is defined by the individual. But I consider myself a lifelong learner and a big supporter of education. I am a Gateway Community College proud adjunct faculty, so I am a gecko like a lot of you on this call as well. And I, like I said, feel that education is one way where we can make a difference and together work towards public health outcomes that are more favorable than they are now and than they have been in the future, in the past. So some of you may be familiar with the Bill of Rights. Hopefully all of us are to a certain extent, but just a history lesson recap. The first Bill of Rights is the first 10 amendments of the Constitution. So that includes, for example, freedom of speech, the right to bear arms, the right to a jury, etc. But in 1944, President Roosevelt introduced the second Bill of Rights. And he really felt that the second Bill of Rights would be a way that the first Bill of Rights could be taken to a deeper level that would provide greater happiness and fulfillment to United States people and provide additional economic entitlements. And so he felt that the Second Bill of Rights would be able to provide greater human dignity as well as greater entitlements. And instead of amending the Constitution, which he thought was going to be more of a bureaucratic act of God, he wanted these to be infused into federal law. Unfortunately, as some of you may already be aware, President Roosevelt died in 1945, less than 15 months after he introduced the Second Bill of Rights within his State of the Union address. But his widow, Eleanor Roosevelt, as chairman of the Universal Declaration of Human Rights, added these rights to their declaration. So basically, the Second Bill of Rights asks that every American has the right to a job, an adequate wage and decent living, a decent home, medical care, economic protection during sickness, accident, old age, or unemployment, and a right to a good education. Now, fast forward almost 80 years later, here we are, 2020. We're in what some would say a great pandemic. Some would say we're in the middle of a great recession, possibly depression. And I feel that a lot of times the Second Bill of Rights is even more relevant today than it may have been in 1944. So some of you may be familiar with the social determinants of health as defined by the CDC. But both in the Healthy People 2020 report as well as the Healthy People 2030 report, more information surrounding these 5 social determinants are explored. And I don't know about all of you, but I feel that these tie very closely to President Roosevelt's Second Bill of Rights. So take a little journey with me now as we talk about and think about workforce development. And we talk about maybe the social determinants of health, and we also think about President Roosevelt's Second Bill of Rights. I don't want to get political, and I certainly want to make this apolitical, but also a bipartisan look at workforce development today. So these are just some definitions that I want to share with all of you so we are all on the same page. These definitions come from the U.S. Bureau of Labor Statistics as to how employment, unemployment, and underemployment are defined. And sometimes within my role with my primary employer, Honor Health, working closely with high school students or college students, for example, especially high school students, parents will approach me and say, oh, well, my child is going to school right now, but looked for a summer job and was not able to find a job, but he or she is not classified as unemployed. Why is that? And that's because the Bureau of Labor Statistics defines unemployment as those who are actively looking for work within the past 4 weeks. So that's why you're probably seeing right now our unemployment rates are fluctuating greatly, hoping that a lot of these individuals are securing employment and therefore our unemployment rate is going down. Believe it or not, I am finding research that within the next few months, we're going to be not necessarily in a period of Great Depression or recession, depending on how you look at it when it comes to unemployment. But not only are we going to come out of this surviving as an economy and as a US culture, but thriving in the fact that a lot of individuals will have greater opportunities than they did pre-COVID to work. And that we're going to go back to a job seekers market, which means that so many individuals will have so many opportunities available to them that employers will have to work extra hard to retain and gain top talent. So that's good news. I'm looking forward to that time. So take a look at these numbers, and I'm not trying to bore you with data so late in the afternoon, especially on Friday Eve, but these data are very fascinating to me. And the fact that when you look, for example, in the first 3 months of COVID, February through May, versus the Great Recession, unemployment for women of all races and ethnicities was higher in May of 2020 than almost 2 years of the Great Recession. Some individuals contribute that to women being moms, for example, and having to care for children, and sometimes careers taking a back seat when they're working from home, and therefore sometimes having to leave their careers. Some attribute that to gender discrimination. Again, I'm not going to get political or personal, but I'll certainly leave those interpretations, and maybe some of you out there have personal anecdotes that can contribute to these data in this conversation. So looking at age, this is what concerns me. One of the areas that concerns me is that our young adults, ages 16 to 24, are the individuals who are really suffering from COVID unemployment. And they're the ones, as you can see, that have been greatly affected by the COVID changes to the marketplace, as well as within their places of employment, or being able to find jobs as well. So looking at race, women versus men, this shows, and actually I mishighlighted, excuse me, but that Hispanic women have been the most affected, but not close behind are Blacks and Asians. Again, very concerning, and an area where hopefully my work is making a difference, but something that I think we all need to be mindful of and be able to help each other as well. And last but not least, education. Most of the individuals participating within this session today are students or members of the education community. And kudos to all of you for pursuing higher education, because I think that, again, within this period of COVID, these are the individuals, as data shows, that have been greatly affected by what's going on within our economy. So how does that tie into my role? My role within my current employer, Honor Health, is really to help individuals both within schools, colleges, high schools, universities, as well as community agencies find and maintain employment with an employer that supports not only the employee's health and well-being while providing a livable wage. And I mean, this conversation could go in many different directions in terms of public health and my role, and how I think it's important that the workforce, for example, is representative of our patient population. It could go in the direction of how I can help provide pathways and pipelines into employment for those seeking work, so that when you look at the social determinants of health, for example, those individuals are not necessarily being negatively altered, or their lives are not being negatively altered by what's going on around us. This is just kind of a brief snapshot as to what is of interest to me personally, but also how I can help. And I definitely would like to look at solutions as our conversation evolves, and didn't want to put that into my presentation because I think there'll be a time for that within the conversation. But upskilling incumbent employees, for example, I am very fortunate that I've been able to work for a very progressive employer for almost 18 years within my primary place of employment, where we not only provide the resources to employees to be upskilled and to have the resources to participate in required mandatory education for their clinical professions, but also to provide them with the financial resources to do that, both through tuition assistance and also helping them, for example, in balancing their work-life balance, work-life school balances, and going back to school. Developing programs for incumbent employees and community members, such as English as a second language classes, high school completion. That also kind of contributes to public health in the way that these individuals then hopefully will not be unemployed as a result of education. But also working with diverse community groups and individuals as a whole, regardless of cultural ethnicity or background, and providing them with tools and resources to pursue their passions as a career. So again, they're hopefully not impacted by unemployment, but also being able to increase the diversity, inclusion, and belonging of the employee population. And that's important as well in being able to set these individuals, these employees up for success, and hopefully, again, hoping that they won't become part of the unemployment numbers. And again, there are just so many different ways that this conversation can go, but this is just kind of a brief snapshot. And I kind of wanted to share with you kind of my take on public health and how it relates. So I welcome any questions as we go, but I thank you for the opportunity to spend some time kind of talking with you about how public health, workforce development, health, and healthcare go into play together.
Leah, have you heard the phrase, first of all, I really enjoyed your PowerPoint presentation. Everything I do is so healthcare based that it was the history lesson I took away a lot from that. But what kept coming back to me was there's a phrase that you have to Maslow before you can bloom. And it looks at, those who are educators out there, Maslow's hierarchy is basically the bottom level of the pyramid is basic needs. And until you can move up that level, it doesn't matter, because if those basic levels aren't met, you can't do anything else. And Bloom's taxonomy is how we learn, right? So you can't, bloom until you Maslow. And that kept coming back to mind as you were going over things. So I really enjoyed that. So.
Thank you, Sophie. No,
yes.
And I mean, basic needs through self-actualization. And I think that's important, not only from a public health perspective, but also from an education perspective. So great integration. Thank you, Sophie.
Yes. I'm going to go ahead and share my screen. And some of what Leah touched on, we're going to just kind of touch on a little bit here. And so really one of the things that I think about from a nursing standpoint is how nurses can fit into public health. And Leah, you really kind of reminded me that there's a whole lot of other people involved with public health, and there's so many opportunities for a career in public health that can be from business, from teaching. And so I found that really interesting. If everyone just kind of looks at, I really liked this picture, similar to how you had the picture with the weaving and how everything is very integrated. I feel like we look at public health, if you look at this iceberg and, here's the public health of our country, of our nation. But there's so much underneath that determines it. And that's those social determinants of health. And until we address those social determinants of health, we aren't going to be able to upskill people, right? We aren't going to be able to have women, have a equal representation in the workforce, or different minority populations. And so I think it's so important that we kind of keep in mind that while public health is sort of on the top, there's so much underneath. So again, just a really, really quick overview of public health. A lot of people look at that as community health, kind of what's in community and what's going on. And Leah, just please feel free to jump in. But these are all the different kinds of areas of public health. And some of this, Dr. Fauci, right? He's one of the biggest faces in public health right now, as leading the fight in coronavirus. But we also look at public health, and that video touched on that. Sometimes we think of just vaccines, but it's all different kinds of things. Any kind of natural disaster. So a lot of people who work in public health are working at, how do we respond? How do we mitigate? Do we do research on this to try to prevent things from happening in the future? So there's quite a bit of different components. The square up in the right hand I really liked, because it kind of goes through, it's not just health promotion, right, or health prevention. It's looking at all different components that contribute to the health, how healthy our community is around us. So one of the things I wanted you to think about is, when you look at your own community and what's around you, what do you see that contributes to the health? And this is where I really encourage students to get involved, because these are opportunities that while you're in school, you can actually get involved. And Leah touched on that idea of social justice. Roosevelt University has a huge mission of social justice, and how can we as individuals get involved? And so I'm in Chicago. Leah, you're in Phoenix, correct? So big, in Chicago, where winter is approaching quickly. And so one of the big issues with public health is, how do we meet the needs of people who don't have some of those basic human rights that you talked about, such as, shelter? How can you have a student if they don't have shelter, if they don't have warm clothes? How can you expect a student to then be able to function and learn and grow? Do people have transportation to work when it's this cold? Maybe people are relying on walking, and now we're looking at public transportation, and do they have the funds and the money for that? So these are just some ideas of things that I came up with. Teaching is always a huge component of public health, and an education piece behind that of teaching people how to be healthy. I think we just assume everyone knows what right foods to eat and all those kinds of things, and that's not necessarily true. Leah, do you have anything to add in Phoenix when you think about public health?
Not at this time, Sophie. I think that you covered.
Did I touch on it? Okay. I didn't know if like in the desert you had to worry about. So one of the things with public health, and again, this is that whole idea of social determinants of health. And I know Leah touched on that, and I'm going to touch on it again because it's that important. So when you look at an iceberg, it's that whole, all of those components underneath. And if these social determinants of health aren't addressed, you can't have public health. You can't have a healthy nation without addressing these social determinants. So we can give coats to people who need it, but we need to dig a little deeper. And we need to find out, again, looking at the education piece. And so I applaud everyone who's, reaching for higher degrees, because research shows that that is going to put you in a healthier position as you grow. And so, and you age. And so it's so important, even access to, and again, not to be political, but access to insurance. In our country right now, it's very hard to get insurance without a full-time job. And so again, how do you get full-time jobs that supply that and are able to give that to you, again, through education? And so we need to look at all of these different social determinants of health and how we can affect them. To me, mentoring is one of the biggest ways. Mentoring young students, mentoring, like I think, Leah, you mentioned working with high school students, and really trying to show them why it matters to stay in school, why it matters to make healthy choices when you're young. Smoking when you're young can affect, I'm looking at from the health nursing standpoint, can affect your risk of cancer when you're older. There's so many decisions that truly, can have lasting effects, not on only your health, but your community's health. So one thing I focus on a lot with my students in this sort of social justice idea at our university is service opportunities. There are so many service opportunities available for students that really help to teach you about social determinants of health and can be very eye-opening. There's a lot, depending on where you come from, that you don't realize from other cultures. So it helps to teach you about other cultures. It helps to teach you about people from all different areas and walks of life. And what does that do for you? It opens your mind, right? It expands your knowledge. You can make a difference in the world, and you really can. On top of that, you network for future career opportunities. You build your resume. So I really go against the idea of just doing things to put on your resume, but this does build your resume, especially if you're truly committed to it. We have had the opportunity with our students to really be involved in some incredibly fun service opportunities that have then gone on to lead what career direction some of them have taken, which I think is really neat. One of the most fun things I've been able to be part of with students is a bus that goes around and finds in street medicine. And this idea, they find homeless people, and then the doctor, the nurse practitioner, and the nurse go out and they're addressing frostbite is something we're going to see in the winter, or they'll give flu vaccines, so they'll be on this mission of finding. And why is it important for a homeless person to have a flu vaccine? Well, of course it's important, because especially if they get sick, they don't have access to care. They're going to get sicker than the average person who may have access to care. They're going to end up in the hospital. So there's so many, possibly. So it's so important that we're able to address these needs. And then I have a student who then went on to want to work in street medicine, just from this service opportunity. So I really would encourage all students and teachers to look at how service opportunities can help to teach social determinants of health. ChicagoCares.com or .org, is an organization in Chicago that there are so many neat projects you can get involved in, from community beautification. So much research shows that if you take pride in where you live, that it encourages you to have momentum and to move forward and to want to be successful. And so what's neat about Chicago Cares is that you can align it to what you're interested in. And so someone who's interested in business can look on this website, and I'm sure you guys have a similar type of website in Phoenix, and find something that's going to relate to them. Maybe it's going out and helping to teach basic budgeting, household budgeting, and things like that. I laugh. My son is a sophomore in college and had to write a check for his rent, and him and his roommate had to YouTube how to write a check because they had never had to do that because everyone uses Venmo now. But even basic things like that. Luckily he knows he has us who can call and teach that to him, but there's many people who don't and really need basic education as to how to get an ATM card. Why is it important to have a bank account? Why is it important to, help to create a good credit profile? So there's opportunities in service projects that aren't just nursing based, checking blood pressures, which is what I think of. It can really, one of my friends is a huge gardener and she volunteers with Chicago Cares to do, to have gardens of fresh food in Chicago. And I don't know if this is true in Phoenix, but we have a lot of what you call food deserts. So we have these areas of low income people who don't have access to fresh food. So the big stores like Whole Foods and when you think Trader Joe's, these are different grocery stores in our area, are a few miles away. And many of these people don't have access to transportation to get there. And so a lot of what they're buying is from your sort of local corner store that isn't fresh food. And so what she's done is gone in and she works in these community gardens where she gets people involved to grow fresh food. And again, that's, working on those social determinants of health. So you can see how it all kind of plays together. So again, I just have listed a whole bunch of different kinds of things you can do. Cultural programs are huge. With my kids this Christmas, we're through an organization I got involved in as a teacher. We're actually going to, hopefully we'll see what happens with COVID, but we're putting on a holiday party for children. And so those, and there's going to be some different people playing different instruments. If you've never lived in an area where you are exposed to people who, we know the arts are just huge for our brains, huge for reaching that actualization. It plays a big part in people's happiness. And we don't want to just be meeting people's basic needs. We want to go a little above that in Maslow's hierarchy. We want to try to find what drives these people and makes them happy. And, choirs. And I have a friend who works at a choir in an area that wouldn't have, she volunteers doing that because they don't have that offered at their school. It doesn't have to be just when you think of blood pressure checks and vaccine clinics and things like that. I would highly encourage everybody to get involved in those kinds of organizations. Again, it's a good resume builder. Employers like to see that. Leah, you could probably speak to that, if that's something you feel like employers really look at. And so that's kind of my take on public health and how, as students, you can actually really go to help address these social determinants of health. I want to end it in a little bit, Laura, with you talking about how that can be specific to Gateway, but I didn't know if maybe, Leah, you had some comments or anything you wanted to add.
Great presentation, Sophie. I mean, so many different angles, again, where public health is infused and everywhere throughout our daily lives, and where we may see examples or we may not, because sometimes public health is the invisible work that the wizards behind the curtain sometimes do to keep us all healthy and safe. But nonetheless, I mean, in regards to resume building, definitely an opportunity to participate in your community and do something good, not only for your health and well-being, but also for maybe someone else's by getting involved. And using community service as a resume builder is a great way to, especially now when employment opportunities may be scarce, especially for new grads or those just entering the field. It's a way to not only give back and help your community, but also build your resume. And so certainly, yes, add those to your resume, add those to your job applications, because employers want to see that you're civically minded as well as professionally minded as well. So I will definitely say that. And also in terms of cultural representation, for example, I mean, think of ways that individuals, you as students, for example, can help the next generation of public health professionals. And sometimes those are direct frontline healthcare employees, such as nurses. But again, sometimes they may be behind the scenes, such as epidemiologists. And think of, like, for example, male nurses. I mean, I wrote one of my master's degree capstones on the role of the male nurse and how that may be one of the answers to the nursing shortages. So think of ways that you can recruit your friends, your family members to join the public health workforce, because we can't do this alone. And there are so many doors that can be opened, not only to those who may be part of some of those cultural groups that I mentioned, who may be looking for new employment opportunities now as a result of COVID, or those who are entering the field as younger professionals and looking for their next destination. So certainly don't exclude anyone from your thoughts, whether it be those of a certain sex or gender. But also, I mean, when we looked at that slide regarding cultural backgrounds, I mean, those cultural backgrounds, in my opinion, are rather limited in the fact that they were based upon 1977 framework that the government put out. And I think that now there are a lot of opportunities for biracial representation, for example, but also looking at the LGBTQ plus community as to how they can get involved as well. Again, so many opportunities for all individuals to make a difference within the public health sphere.
One of the things that I have found volunteering and service opportunities is that you learn one way in school, and then you realize kind of how the real world works. And so I've had students, have a patient, not a patient, that's not really the right word, a client that we meet out in the public health world, and they're confused. Well, this is a diabetic patient. Why don't they take insulin? Well, they can't afford it. They don't have insurance and they can't afford it. And they felt stuck. Well, then what would we teach them? And how do we deal with that? And that was really eye-opening them to realize, they don't. So now we have to try to work around that and see what else we can do. Can we somehow link them to a system that will provide it? But people also have free will. And if they choose not to do that, how can we then help them to be healthy and meet them where they are? And to me, I found that so fascinating about public health is, eat your fruits and vegetables and go to the doctor once a year and get a mammogram once a year. And so many people don't do that. So how do we meet them where they are and still help to educate and still help to make the world a better place? And, one of the clients that we would see really needed, because of his diabetes, he needed foot care. And so he wasn't going to take insulin. Especially there's a mental health component to it, which is common sometimes that we would see with street medicine. But we were able to at least help provide him with foot care so that his feet were not getting more infected and hurting. And think how much that would affect your quality of life, especially if you live in the streets, the ability to walk around and not have your feet constantly hurt. And so it kind of makes you look at the world a little bit differently from how you're sort of taught to do things. And so I don't know, I find that as another kind of big advantage to getting involved and opening your mind up to other situations. That was kind of a long answer discussing, but something that came up in my mind. And I agree with you, Burger King is definitely a respectable job, but I just feel like also try to do something else if you can, if it's possible. So, Laura, did you want to discuss how Gateway can actually, the different programs you guys offer?
Absolutely. Thank you. And your discussion, being the teacher in me was like, I can contribute.
Do then.
But you guys gave so much good information. I certainly didn't want to. But your point on, it had me thinking, being a transplant down here now from Chicago, how we were down here in the summer looking for housing, and it was 117. And the same thing, you see homeless people in 117, and it may not be frostbite, but it will be heat stroke. So just the differences throughout the U.S. and, when horrible weather has been coming in through these hurricanes and things like that. Everywhere there's something in the environment that can really affect people's living conditions and status. So it just really made you think through all that. So that was great. Gateway is super, super blessed to have so many choices that students can go in healthcare. And I'm going to avoid reading the list, because if you want to go to our Gateway Community College website, we're in Phoenix, and kind of explore all of our different career paths. But we have, both the whole clinical sector as well as the administrative side that you can get into. And I think the one thing the students have seen is that there's components in both that can get them involved in public health and education, and just, helping our neighbor is really what it boils down to with community health. Just to list some of them, and then I'll talk about a couple of specific initiatives that we have that make Gateway's program special. So we have everything from clinical career paths like nursing, medical assisting, phlebotomy, EKG, surgical technology, pharmacy technician, medical billing and coding, to kind of get to the administrative side. We have health services management and health unit coordinating, health regulatory compliance. And this is truly probably 10 or 12 different options from a list of about 25 different program choices here. So I strongly encourage, anybody listening who is thinking of a career path. And I think the pandemic is also bringing into, from Leah's slides that show the amount of jobs that have been lost during this pandemic. Healthcare's been working ever since March 21st, or whenever you went into, some of this isolation measures, and they're looking for employees. Like, that hiring has really never stopped there. So it's one of those things that, maybe we can discuss after I kind of talk about a couple of other initiatives, that this is a really good time for people to maybe look at what they were doing and what might be rebounding slower, and some of the different career paths that need help. And Gateway has some really quick career paths that students can choose. And, whether you're 16 looking at what to go into in a few years, to 18 and needing a career right now, to 50 and needing to change directions because it's not working right now, or that industry is not going to bounce back as fast. Healthcare is there, and you can get out there and working in a semester in some of these programs. So that's really exciting. One of the things on community health, and I know Sophie, you talked about this with social justice, and kind of bringing that into the class up there in Chicago. We do the same thing down here, and we are so lucky. We have a brand new what we call the Hug Clinic, and the Hug Clinic takes in some of our different majors here, and they work and bring services to the community, to those who can't afford it. So they do ultrasounds for, moms in the community. They do physical therapy. They do nutrition education, occupational health. They provide flu clinics. And we've just started incorporating our Spanish medical interpreter program in there as well, because so many of the people who come in can't speak English. And, that now is, helping both our profession here with the university and getting them some clinical hours, but really helping us communicate with them better. So that's something that a lot of our different programs can participate in here as part of their program. So that's really exciting. We also have a brand new safe patient handling lab, which is right where our Hug Clinic is. And with that, we're looking forward to taking it out to the community and offering it not only to healthcare workers and nurses who need that patient handling and how to do it to not get injured, but also take it to community who is taking care of a parent in their home, and how they can do it safely and not get themselves hurt because they are the responsible party for caring for one or two adults or children or disabled. So that's something that we're hoping to bring out. We had a little bit of a glitch with COVID, not making that as available right away, but those are two options that we have that we're really hoping to bring into the community even more and in our healthcare programs.
Laura, I know one of the things we were kind of thinking about when we spoke was also the risks and benefits of working in public health. And it's interesting because I had a hard time coming up with risks. Like, even though I know there's risk to exposure, especially when COVID started, it was very difficult with the availability of PPE, so that protective equipment. And I do feel like in Chicago, that problem's fixed. It's pretty readily available. Like anything, the public health response at first is hard because we had never experienced something like this, and we really had to adequately figure out how to get people to be safe in those environments. So that to me is always the biggest risk working in public health, is that you may be exposed to something. But honestly, I don't know. I don't think it's that big of a risk. But the benefit, I will tell you, the quote I teach all my students is, the best way to find yourself is to lose yourself in the service of others. And I cannot tell you how much you will get back for helping other people. And when COVID was going on and everyone was taking all these classes, I was like, all right, I'm gonna jump on bandwagon. And I can now say I took a Yale class because I took the online Science of Happiness Yale course, which is free. And it's their most popular course. And I highly recommend, if you just Google the Science of Happiness, you get to sit in on this Yale class virtually for 8 weeks. It's recorded, but for 8 weeks. And time again, they looked at they really took a scientific approach to happiness. And we know how much mental health can affect every aspect of your life. And really, when they looked at job and career choices, happiness was not determined by the amount of money you made. And that once you got, obviously being able to pay your bills was important. But really, when they looked at people who made high salaries, when we think about that, it did not affect their happiness. And their happiness was, and this was research and science-based. This wasn't just, what people said. Like, this was true research studies done. And it really looked at that component of helping other people and feeling like you are contributing to the world around you, truly was increasing people's happiness indexes. So if you want to look at a benefit from working in a public health career, is that it can help you. There's certain burnout. I always think when you work with public health, one of the hardest things for me as a nurse was people have free will. And I would say that to my students all the time. And it would be hard when you wanted to help them so much and they were maybe okay with the situation. And so then you kind of met them where they were. That, I think, is hard sometimes to wrap your mind around that. But to me, what I would get back, and I don't know if Leah, you would agree with this from a business standpoint, and I know you're not necessarily doing hands-on patient care, but from how you work in public health, would you agree with that statement that what you get back is so much more?
Yes, definitely. I think that even if you just put in a small percentage that you give, or what you receive back exponentially.
Mm-hmm. Absolutely. I also think one of the things I found really interesting this summer related to COVID is, one thing I did with students was basically, it was called like a grocery grab. And so we had these certain days, and food depositories donated fresh food. It was all healthy. The whole idea is, looking at these social determinants of health. But what was very interesting is that a lot of people from the North Shore, which is considered sort of a more wealthy area of the Chicagoland area, would come. And they said, you'd be surprised, even though someone is in a fancy car, they've lost their jobs. And so while they still may have their car or their house and they still live in this community, they still didn't have the money for fresh, access to fresh food. And so it really taught you not to stereotype as well, and not to just, I don't know if that makes sense, but I found that really interesting, that it was all walks of life who came to this grocery grab. It wasn't, you couldn't have just said it was a certain population that you saw. COVID had affected people in many ways in their jobs from across the board. Certainly some people were affected greater, but I found that really interesting. And another benefit from working in public health is, I think it helps you to not make sort of preconceived ideas about people. So just to add that in. I don't know, Lee, if you have any idea of risks that you can think about.
I was right there with you, Sophie, in terms of thinking of PPE, for example.
Right.
But really, I would say that the greatest advantages outweigh the risks, and just being able to not only give back, but be open to what you'll get back in return. And I mean, just knowing that, for example, I contribute to helping to fill vacancies or helping individuals put together a resume, for example, that helps them pursue their passion into healthcare employment. And then that in turn helps our patients, because we need those individuals at the bedside so they can heal and see greater health outcomes. I mean, I can't necessarily say directly that I'm a public healthcare professional, but I'd like to say that hopefully I'm impacting greater public health outcomes and being able to have our patients be well cared for and being able to provide them with the support they need. And so I definitely agree with you. There are definitely more strengths and more opportunities than there are risks or disadvantages to pursuing a career or just an opportunity to volunteer within a public health space.
And I would agree with you. I wouldn't say I'm a public health necessarily worker right now either, but I'm getting, I feel like I'm affecting public health outcomes through what I'm doing with students as well. Laura, one of the things you talked about, one of your programs was regulatory. Tell me about that. That's fascinating. And so, there is lots of opportunity for that from an inpatient side. And I will tell you, one really good thing about working in hospitals is they usually give you really good insurance. And so, I mean, at least in the Chicagoland area, you have really good insurance. And to me, when you're in a hospital setting, even if you're not doing direct patient care, there's kind of this like fun energy to that. So all of those careers that are in a hospital, if you kind of thought, no, I don't want to be a nurse, and so you sort of put that aside, there's so many other jobs that will put you kind of in it all, which is exciting and fun. I love, Leah, what you said about male nurses too. Huge opportunity for males in the workforce. And I'm really seeing, especially in Chicago, I would say in our ICUs, in our ERs, more than half of the nurses in some departments are males now. So we're definitely seeing that. And when you talk about, LGBTQ+ population, typically, I think hospitals tend to be areas that are very open-minded to that too. At least the large institutions that I've been part of, and tons of opportunity for that too. People just overall, I find, tend to be, if you deal with the population in general, you just realize that there's all different types of people, and those biases that some people may have, I feel like really tend to, the more you know and the more you're exposed, you just do better, and it helps to offset that. But Laura, I had asked you about the regulatory program. I think that's really cool.
Yeah, the interesting thing that kind of made me think too, and we've had a lot of conversations that we're talking about at the college on, people who are displaced from jobs right now and who, aren't going to be able to get back to their regular jobs in a quick fashion. A lot of the industries that are closed down, so to speak, right now, have a lot of those soft skills and just skills in general that would translate into healthcare really well. So the fact they don't have to be clinical, there's plenty of administrative duties and behind the scenes that, they don't realize is out there. And I think that's one of those things I always think, because I've always had this public health degree, but nobody knew what public health was. Everybody would always ask, what's that degree? What's it in? And now almost everybody out there, if you've watched any portion of the news, knows a public health official and knows the term public health. So it's just interesting times. Do you mind if we move to some questions?
Yes, I have one comment, Laura. Can I add to go on? The one of the industries in Chicago that has been the most affected is the restaurant industry. And so my background before I was a nurse was I was a waitress in multiple different, I met my husband waiting tables. We both waited tables together at Pickles and Champaign, if anyone went to U of I. And I cannot tell you how many skills that I developed waiting tables and bartending as well have translated to healthcare. So don't dismiss those jobs. especially I imagine, Leah, that's something you really help them to drill down and see those skills, from people skills to managing a fast-paced environment with a lot of people who want things from you now. I mean, it is, I cannot tell you, I feel like that prepared me for nursing almost more than anything else I ever did. So just something to think about, because that is an industry that's been impacted, and that I do think especially the younger generation in that industry is having to pivot. So, and kind of look at other opportunities. So just something to think about, that if you enjoy doing that, you might enjoy healthcare too. It's a similar fast-paced, helping people kind of feel. So sorry, that was my last comment.
No, I'm glad you made that, because that is one of the fields that we have talked about extensively. So just that reinforcement without even knowing our conversation was very pertinent.
Good.
So one of the questions is, what drew each of you into your current fields, and did your focus change over the years?
Do you want to go first, Leah?
Sure. So I knew in high school that I wanted to pursue a career in healthcare, because I was one of the few girls in science class that got excited when we were dissecting frogs. And so I knew that healthcare was for me, and originally started my career path in the neuroscience or cardiovascular science to become a surgeon. And then as my education continued, and as I received advice from mentors, realized that I was very much a people person through self-discovery, and that my patients would be unconscious in front of me as a surgeon. So I dabbled a little bit in physical therapy, applied to medical schools, physical therapy schools, and realized that, again, more of a people person, and even thought about doing computer software design for physical therapy patients at home. But then again, realized too much of a people person, no disrespect to the computer scientists or computer programmers out there, but realized that I needed more human interaction. So that's when I started to pursue more of kind of the administration side of healthcare. And that's where I found that, because of my love for education, that my worlds between education, business, and healthcare had started to collide. And so have always been since then in the administration side of healthcare, and being able to kind of not only pursue my love and development for healthcare, but also my love for education, and being able to work with others to infuse those passions and those interests has really made me enjoy my career path even more so.
I love that, Leah. I could relate to you. I also like dissecting the frogs in biology. I had someone who, no one in my family has ever been in healthcare. And actually, a boyfriend I had in high school, his sister was a neonatal intensive care nurse. And hearing her stories, and this is where, I think if instructors who are watching this, or anyone, that sharing your career stories and sharing what you like and enjoy with younger generations really does impact. And I have gone back and written every year on Nurses Week. I send, her name is Mimi, I send her a message over Facebook that, just so you know, you put me on this path, when I was 15 and 16. So I really liked hearing her stories, and I kind of just knew nursing is what I wanted to do. I never liked when people said, "Oh, did you not want to be a doctor? Is that why you were going to be a nurse?" And to me, and I don't know if you hear that as much anymore, but to me, I felt like nursing really looked at the whole person. Also, if I could plug nursing a little bit, one cool thing about nursing is you can pivot a lot in your career. And that's not really the case for med school. Certainly we need good doctors out there, but I talk about this with some of my doctor friends. Once you're a surgeon, you're a surgeon. You really can't then decide, oh, I'm going to be an obstetrician, or, there's some pivoting, but not a lot, oh, I'm going to be a pediatrician, because they go to residency and they have to go through education in their exact sort of area of interest. And it would be a lot more education to pivot. Whereas in nursing, you really can change your career. I could decide right now, I want to be a surgical nurse. And I would probably get the night shift because I would be new in that field, but you can pivot a lot. And so I've always been in women's health. That has always been what's interested me. But I've worked, in labor and delivery. I've worked with mother and babies. I run a postpartum depression support group. I've taught women's health nursing. I have, and that kind of pivoted me into teaching mental health nursing as well as community health, because they're very similar. And so I found that, to me, one of the best things about being a nurse is that there's so many opportunities. And I always say, I don't know what I want to do when I grow up. I'm still thinking about what kind of nurse I might end up being one day. So that was I don't know. I always loved nursing and just found that patient interaction incredibly fulfilling to do that. So that's sort of my path.
So we weren't going to avoid the COVID. We've got a few questions on this, and interestingly, they're coming from both different angles as to what has your experience been with COVID in your areas or in your career. Who wants to tackle that one?
I can speak very specifically from a nursing standpoint. One of my many hats that I wear is a prenatal education educator. And unfortunately with COVID, pregnant women being a somewhat high-risk population, we cannot bring them in groups of 20 to teach. And so we still aren't doing in-person teaching. And the teaching that patients get before they have a baby is huge in helping their outcomes from a mental health standpoint, to just, on many, from safety to the newborn. And so we've had to really pivot and figure out how can we still meet these needs of patients. And so eventually we've worked and gotten into classes like this. But then also I was able to take on a new role that we never even thought about, where now the educators go in once a week and we each take a day and we round on the patients who are being discharged that day. So I just one day a week go to Northwestern and I start at 7:30 in the morning and I might see 20 patients that day, and I'm able to do one-on-one education with them. And it's really been interesting and rewarding, but we've had to pivot in that way because we can't really do group education at this point. And so that's where I have seen COVID personally affect my job the most. And then obviously, as an instructor, we all have learned how to teach over Zoom. Just kind of two very specific examples. Obviously, hospitals have had to just pivot and adjust. But I also think healthcare professionals are used to having to pivot and adjust, and they have really done a good job. I almost feel the most normal, I'll say, during COVID at the hospital. Granted, everyone is wearing masks, but it feels the most normal because that has to continue, So it's funny, when we were on lockdown here in Illinois, and that's just mentally hard for everybody. I relished going in and doing discharge instructions because it just felt normal to be. For me, I just feed on that interaction, and Zoom doesn't do it for me. And so that was, it was interesting how much that gave me to do that. So that, just to speak very specifically to my own experience. I'd be interested to hear what Leah has to say.
Sure. So prior to COVID, I was really focused within my primary place of employment at Honor Health, tailored to the silent job seeker, and working with building those pipelines and pathways into employment with, again, college, university students, and also community members. And as a result of COVID, as you can imagine, my work went from being in the community, have car, will travel, to being in front of the computer. And so even though I was used to working remotely, it was a different world. And so being able to now work with those, unfortunately, who have been impacted by COVID from an unemployment perspective, the nice thing, and Laura briefly touched upon this, is healthcare has been a relatively stable place of employment as an industry as a whole throughout COVID, because not only are we as an employer at Honor Health expanding, but as an industry, we constantly need these professionals to not only now take care of our COVID patients, but also those birthing mothers or those newborns or those pediatric patients who may be diagnosed with life-changing conditions, or those geriatric patients, and everyone in between. And even though elective surgeries were somewhat shut down for a period of time within the state of Arizona, now that elective surgeries have returned, again, we have a full gamut of patients who need care 24/7, 365, and we have 1,000 job openings to fill at Honor Health. And so that's kind of how my role has changed, in the fact that now these are individuals who are actively pursuing employment because either they know that healthcare is a stable industry and that's where they want to go. Don't get me wrong, we were affected by the pandemic too, But again, we still have patients to care for, but also these individuals who are now looking for career transitions, either voluntarily or involuntarily, and working with them. But being a Gateway Community College instructor, we switched from a hybrid format modality to a fully online modality come March in the middle of spring semester, and have been online since. But also as a small business owner now, I mean, I've been very fortunate and very humbled that my small business has grown as a result of COVID, and the fact that I'm able to career coach more individuals. And that's what I love, is being able to help them find their fulfillment through work. I mean, working is a privilege. And so, I mean, those individuals who want to work, who can work, I want to help them find that work. And so being able to get them career ready or for their next professional destination, but also working with non-governmental organizations or nonprofits in terms of now they have access to grant dollars through third parties, for example, to help them upskill their population. And so working with those groups to be able to provide those solutions to them has really helped my small business grow. So it's, I mean, it's been a pivot, and I think that's been one of the words of 2020, but for me, at least, it's been a good pivot. And I mean, don't get me wrong, I don't wish COVID upon anyone or any population or any culture, but I think that we have to look at the positives and what COVID has brought, and even to the healthcare industry, for example, new roles and new opportunities for individuals to become involved, whether that be the respiratory therapists and how they've been able to really have their time in the limelight as a result, public health professionals, as Laura mentioned, nurses, but also, I mean, these new roles such as COVID testers and screeners, for example, who have, these roles have emerged as a result of COVID and been able to really help individuals get onto the pathway into healthcare employment.
Leah, one thing two comments. First of all, as a women's health nurse, we're about getting to be 9 months out from when everything started. And so we're seeing a baby boom. So it's been there's a lot more business in that end for us right now. But Laura, I thought I saw a question about telemedicine pop up. Can you read that question? Because I have some comments on that.
Yes, we have a question on, has telemedicine or remote work opened opportunities to work in healthcare for IT students or professionals?
That's a great question. I think that I would say yes, because there's a lot of IT support for doctors and nurses who maybe haven't been really used to that kind of technology. So absolutely. And I have seen telemedicine. I think that's huge. In Chicago, we have great access to healthcare because we're a large urban area. That is not true around the country. There's parts of Nevada where people are driving hundreds of miles for an OB. And so having telemedicine that is robust, that meets regulatory requirements for HIPAA is huge. And I feel like COVID has made that sort of elevate up to importance, where I felt like before it was like nice if they could do it. And now we're really seeing how important it is. And the benefit of it, having a mother who's in her 80s gone through different issues, what I've really found is how often I've said, well, is it really necessary I bring her in to discuss this medication? Because I would prefer not to expose her. And they absolutely. And so doctors that never offered that before, from a reimbursement standpoint, are now being able to offer, because we've seen, and that's where IT can really get involved, is to build those programs behind how people are billed and who gets billed and how that works. And so I think it's going to just continue to grow. I don't see telemedicine or telehealth going away, especially from a mental health component too. I think it's huge. And really garners some huge amount of access to people who wouldn't have had access before to mental health professionals. So my answer to that would be yes. I don't know, Leah, if you would agree. You may know a little more about that, but what I see, I would say yes.
No, I definitely would agree. And I'm glad that there are individuals in the audience, and being a college level audience is a lot different in talking about healthcare IT than when I talk with high school students, for example, because a lot of times I challenge high school students to tell me of a career path that they're interested in that does not exist in healthcare, because we have so many diverse career pathing opportunities available. And sometimes they'll mention IT, and I'm like, really, let's talk. I mean, everything from administrative roles to clinical roles. deals with IT in some shape or fashion, and especially with telemedicine now being at the forefront, I think that telemedicine has opened a lot of doors not only to patients, especially those patients with disabilities, for example. And so I'm hoping, and I think that this trend as a result of COVID will stay, and the fact that telemedicine will hopefully still continue to be an option for patients and healthcare providers to exercise equally as we move forward post-COVIDia. But I'm also hoping that it opens a lot of doors for employment as well. And one of those doors that I'm seeing open at Honor Health and with other employers is it allows us to recruit individuals from outside of state lines, not only in the IT space, but in all spaces. It might be a little bit more difficult for a clinical professional, but from a recruitment and retention perspective, it really allows us for non-clinical professionals to expand our reach and tap into other markets that we haven't been able to tap into prior to COVID. So again, I think look at the positive and look at all the innovations that are resulting as a result of COVID, rather than, don't get me wrong, I mean, there are certain aspects that are somewhat dismal, such as being stuck at home for so many months and not being able to have social lives like we did before, but this too shall pass. And so I think that if we look at the positives and how our economy and how our people have changed as a result, I think we'll come out shining, I hope.
Leah, I think there's also now, because there's certainly, when you talk clinical, people are licensed in certain states. And so there's always been laws and rules about how you deal with telehealth in that sense. And I think what I'm seeing is a push to solve those problems now. Whereas before it kind of was just something that stalled, where now we're seeing the importance of trying to solve those problems. And so I hope that's a positive that we really see from this.
Agreed. And I think from an Arizona perspective, again, not to get political, but I think that hopefully this is a bipartisan initiative, regardless of your political beliefs, that especially as healthcare professionals, we can buy into. Our governor, Doug Ducey, has done a lot for those regulations in terms of being able to have professionals be licensed in multiple states, or at least have a license in one state and be able to translate that into the state of Arizona. And so, again, I'm hoping that'll be something that'll become a bipartisan initiative and a positive result of COVID, and allow healthcare professionals, clinical or non-clinical, to be able to still contribute regardless of what some may say were past bureaucracies.
Both of you reminded me in your discussion too, to just again remind everyone who's out there listening that, it doesn't have to be that clinical track or that obvious administrative track for a hospital. They need accountants, and they need IT professionals, and they need operations. And there's so many different paths that you can work on in there.
But
so
I would also say, especially at large medical centers, we need people to still work in the cafeteria. We need people to still work at all those restaurants that are there. So if that is your skill set, those aren't being shut down, and they still, now while they, in Illinois, while they're not able to, some of the tables, it's interesting, you can't sit at a table inside the little alcove, but you can once you go out into the hospital area, but you still have to be socially distanced. But those jobs, they have pretty good job security. And so, the Starbucks in the hospital, the Chipotle in the hospital, those are very busy places that constantly need. So just maybe think out of the box a little bit too. And if that, some people may not realize that those are areas that are still, that are very busy still. So.
Great. So I know you guys have kind of touched on this one already, but I think these stories and the different opportunities are what people are interested in hearing too. Can you describe a community health education initiative that you contributed to in your area? I think you've both talked about a few, but I'm sure you have multiple. So if you have another one, if you could share it.
So working at Honor Health, for example, we're one of the few hospitals in the nation that has a food bank tied to it. And so we're very fortunate in the fact that, again, talking about the social determinants of health, whether they affect career or not, that food bank provides the nourishment to our community members and even to our employees who are in need of having access to those fresh fruits and vegetables or other healthy foods to be able to sustain themselves and their families during these times as well as others. So being able to participate and volunteer at Desert Mission is something that I hold very precious and near and dear to my heart, because it not only feeds our community literally, but it feeds my soul, and it feeds probably the soul of those individuals who are taking advantage of those services. And also, I mean, just another community health / public health initiative that I'm proud to do, again, regardless of politics, is wear a mask, especially now, and being able to keep not only myself safe, but more importantly, keep those around me safe. And I mean, this COVID disease is so, we don't know much about it. We're learning more and more as the days go on. But I mean, we all, I think, can agree that we may be asymptomatic and we don't know it. And so it's just one of those small things that we can do to keep each other safe. And so I'm proud to do it and feel like a frontline healthcare employee, proud healthcare employee when I do it, even though I'm not.
I love that. I think that so many people will look to, I tell my students that if they know you're nursing students, they're going to look at you to model that kind of behavior. And I do think that there is, it was funny, I stopped by a neighbor's kind of backyard thing the other day, and I had my mask on, and someone said, "Look at you setting an example." And I'm like, yes, I know we're outside, but, I am sitting, like, it's the right thing to do. And so I think it's, important that we set those examples, and it does show kindness over anything else. Laura, my most favorite area that I've been involved in is probably the night ministry. And in Chicago, there's a homeless shelter that is the only one in Chicago that will take under 18 mothers with their infants. And so someone who's maybe 15 and has a baby and is homeless, or has run away from home or is left in an unsafe situation, they will actually take them with their babies. And so it's just, that to me has been one of the most rewarding things to just be involved in, from a mentoring standpoint, to feeling like we could really just help them, doing a lot of education on how to take care of their children and what to do. So that would be one of the things that I'm been most excited to be involved with.
And I think both of those things that you mentioned kind of lead us into the season of giving that we're in, leading up to Thanksgiving, and just for everybody to remember how many people have been affected. Probably every single person out there is in a different circumstance to what they were last year, whether you weren't affected or not. There's still differences that are, all around us. So kind of maybe make a plug here to everybody can do something. And, whether it's donating that one can of food, or, giving that $1 on the street, or volunteering your time. So there's lots that can be done right now, which kind of leads to this question, which I think is great, is we've talked about how important service opportunities are for the resume. How does somebody put them on their resume? Kind of where should they go, and what's important to bring out from, these service opportunities?
I'm going to let Leah answer that, because I think you probably have a lot more experience. Laura, one other thing I want to add, when you talk about whether it's giving one can of, I think it is so important to make people know they have value. And so there is no way, living in Chicago, I could give money every single time to someone. There's just no way. But I always try to make eye contact and smile. And, it truly, and sometimes there may be some mental illness there, and the response is entertaining. But more often than not, I get a smile back. I get a good morning. I get thank you. And so don't underestimate how your behavior, maybe with a mask on, you smile, people see it in your eyes, or wave, or people should not be marginalized. We have no idea why someone ended up where they are. I think we are all much closer than we think to being in a situation like that, and we take advantage the safety nets around us, and how many people don't have that. And so really, it's if you can just smile and give someone value, I think that is huge as well. So just sometimes I think if you don't have money to give someone, you kind of feel like, oh, I can't really help, but there's more you can do than just that. So, but I'll let Leah answer the resume question, because I'm not sure. I'd love to hear what the best way to do that is.
Sure. And real quick, I do want to say, Laura, in regards to donating food, for example, especially since this is 'tis the season, one of the tips that I learned at Desert Mission that I find very helpful as when we talk about public health and helping those who are less fortunate around us is in terms of donating canned food, for example, donate cans with pop tops because those individuals whom are receiving the food may not have can openers, for example. And so sometimes if I donate tuna or peanut butter usually doesn't come in a can, but something that's like healthy and protein rich, such as tuna or canned fish, I donate a can opener also if I can't find tuna with a pop top. But also, I also learned that popcorn is shelf stable for many years, like it never expires. So in terms of cleaning out your pantry, for example, and trying to do good at this time of year, those are ways that you can really make your donation make an impact. But in regards to community service, this is something that I could go on and on about because, again, being a career coach and being able to help individuals, this is one of my favorite topics in terms of how to structure your resume. But first and foremost, make sure that you have more than one resume. Don't use the same resume for every job that you're applying for, only because chances are the resume may not necessarily fit the job. And if you're applying to ABC Hospital, make sure that it says something about ABC Hospital if you're infusing ABC Hospital like into your cover letter, and make sure it doesn't say like XYZ Clinic. And then that way that ensures that you are actually engaged within the process and you know to which employer you're applying. But putting community service, I think, is very valuable. But look at the job posting, for example. And if the job posting is highlighting, let's say, hypothetically, an associate's degree or a bachelor's degree, I mean, you could put that at the top of your resume, for example, if you don't have like necessarily the exact professional experience that it's calling for. So if it's calling for 1 to 3 years of professional experience and you have 1 year, but it's calling for an associate's degree and you have a bachelor's, maybe put that bachelor's degree at the top, put your experience below the education, and then put the community service after the experience, if that makes sense. If you don't have the bachelor's degree that it's asking for, if you don't have the 1 year of experience, put the community service at the top, because then that way it shows that you have done something, and each employer will treat that differently as to if that counts for years of experience or not. So, I mean, you kind of need to know the employer, and you can get to know the employer through informational interviews, or as you do your clinical experiences, for example, you can ask, does community service count for years of experience? And if it doesn't, don't not apply. Just make sure that you're able to talk about how your community service experience, when you land an interview or even in a cover letter, if it's requested or required to apply, how that community service qualifies as experience. Hopefully that helps.
Can I ask a question on what do you think about? I have not had a lot of experience looking at resumes or hiring. However, I guess I feel like Feed My Starving Children. I mean, that's great. It's a great organization, but it's like you do it with Girl Scouts, or you do it like that's fine. I've done that. I know you go for a couple hours. If you're looking at doing community service, do you see trying to maybe get involved with one organization that you've gone multiple times? So whether you eventually led a group, or whether, like, if you could try to get some of those skills out of an experience, so it's not just like Feed My Starving Children and I did this and I did that and did that, but instead I was very engaged in this one organization and I led a youth group through, something or other. I got to teach this to them. To me, that would be more, not that other isn't but valuable on a resume.
I think it's important to get to know the organization and have them get to know you. So that may be through regular Saturday commitments, for example, or that may be a few times, or that may be having a leadership role within the organization. But then again, I mean, if you have a lot of spare time, for example, I don't want you to limit yourself. So if community service is where you feel you can make a difference right now, and you have the time and the resources available to participate in community service over employment, for example, or if you're only going to school part-time, then become involved in lots of different community service organizations. But to your point, Sophie, I think it's really important that you not only get to know them so you can speak to their mission and what you did for that organization, but they get to know you, because you probably also want, not that it's all about like Sophie said earlier, it's not all about the resume, it's not all about just the references also, but if you're not working, then you also want to be able to have professional references through those community service groups who can talk about your work ethic and what you did for them, rather than saying, well, yeah, we saw her one Saturday a month, but she was really quiet and she kind of did her own thing. We don't really know who she is. I mean, get to know them, have them get to know you. And that way you're not only doing good for the community, but you're building relationships. And that's also part of public health, in my opinion, is being able to build relationships that help promote the greater good for our communities that we serve.
And a lot of those not-for-profits are going to look to hire people at one point. And so if you have, don't knock that could be some job opportunities for you as well. So
networking.
Yes, it's always networking. Exactly. So don't just show up and scoop the food, make some conversations, even just ask questions. Who do you serve? Why do you like working here? People, my husband was a fly fishing guide for years in college, and all different people, you're on the boat for hours and hours and hours with these people on the river. And he said, you just ask people questions. People like to talk about themselves. So, even if you just ask questions, and you might be surprised, A, what you learn, but B, they'll remember you because you seem engaged and interested.
So true. And Sophie, I'll take that to the next level and just say, as an employer and a hiring manager, remember that almost every opportunity to engage professionally, even if you're not necessarily wearing the student or employee hat, is an opportunity to interview. So be your professional self in terms of how you represent yourself and what conversations you talk about with these individuals. I mean, don't get me wrong, there's something to be said about making friends and building camaraderie and things like that. But just like being in an interview, anything you say can be used to your detriment as well as to your benefit in the future. So make sure that you're representing yourself as your best professional self.
I think that advice is given often where never burn a bridge, right? You never know where you're going to see somebody again, and even a small experience could help. Which you guys kind of led into this last question a little bit, but maybe you can come up with another. What is a good piece of advice to students who want to go into community or public health or any of the areas in healthcare? Or just maybe even a piece of advice that somebody gave you that really helped you?
Laura, I'm going to go first because I think be open to all different kinds of experiences and really take every learning opportunity that you can. If you can always have an attitude of learning throughout your entire life, and Leah touched on this earlier, you will be amazed at what's out there. And so always be open to learning experiences. And then the not burn your bridges, because Laura and I became colleagues because of a former colleague I had who reached out to me when Laura was looking for a specific instructor. And again, it's those connections and networking. And I'm sure, Leah, this is something you talk about all the time with your students, but it cannot be underestimated how important. And then my other advice is show up on time, show up 5 minutes early. I cannot tell you how important it is to show up on time. It speaks volumes for your commitment and your seriousness about the job. And put your phone in your pocket. My generation doesn't get, this. Well, oh wait, yeah, it is. We don't get it. It is not. When I go to dinner with my friends, our phones are put down. Like it is. I mean, of course, every now and again, but it is. I know you guys are used to talking while you're looking at a phone. You just can't do that in the workplace. So those are my advice. That's my advice.
So be open, in addition to what Sophie said, which I think are all wise words of wisdom, be open to change, especially now, because there are so many opportunities where doors are going to open that you may or not realize it. And we briefly kind of touched on how the world of healthcare, the healthcare workforce has changed as a result of COVID, and just looking at, not necessarily being set on just one path when there may be opportunities that are presented to you that can still help you reach your ultimate goal, but it's through those twists and turns. And a lot of times, I mean, previous generations have referred to career progression as a career ladder, that we're always just trying to reach the top. And think of it as a career path in regards that there are so many twists and turns that your career may take. And sometimes your career will go sideways, meaning you may take lateral positions, either just to learn more, to meet new people, or because you were possibly hypothetically in a toxic work environment, for example, and you wanted to get out and you just wanted to do anything except be in that one position. But also think of ways that your career may go upwards, or there may be opportunities, unfortunately, where we see our careers go backwards as a result of COVID or as a result of other priorities, maybe family, for example, or health priorities, personal health priorities. And so just being open to that, because it doesn't have to be a struggle to reach the top. I mean, we have to think about our personal health and well-being, and that too goes into public health, and the fact that we don't want to just be another statistic that deals with type 2 diabetes or heart attack or arthritis, for example. We want to be able to take a breath and enjoy life and be able to find balance and purpose and be mindful in what we're doing. And so in terms of career progression, just being open to change and being able to take care of yourself along the way, and maybe potentially, if not now, if it's something that is part of your life plan, taking care of a family as well. And you don't want to be too focused on career that you miss out on opportunities to travel or enjoy life or just be with those you love.
I would add to that, to kind of add to what you're saying. If you don't practice self-care, you're not going to be good in the workforce. It will eventually start to affect your work performance. It really is all interconnected. And I think that's where you see burnout. And, luckily, I feel like I'm really seeing that work-life balance being promoted a lot more now than maybe 10 or 15 years ago. I don't know, Leah, would you agree with that? That I feel like employers find that they respect that versus someone who just, I'm going to work. I don't know if you would agree with that or not, but.
Usually, yes.
Yeah, not
yes.
always, yeah.
I think it depends on the employer and the type of work too, but also the type of individual, because a lot of times we get out of work what we put into it. And sometimes for those of us who want to work, it may be difficult to see that balance, or even if the employer encourages that balance, for us to take advantage of that balance. So again, I mean, taking care of yourself, but knowing yourself as well as to if that's something that's important to you, and seeking out those employers, because I think that even though work-life balance is on the forefront now and a lot more employers respect that, I don't know if necessarily some employees take advantage of that, because to Sophie's point, I mean, regardless of generation, we're all still connected by this device.
Yeah.
And I mean, we have now the ability to, as healthcare professionals, not only get our work email on our phones, but also sometimes we have EMR access, for example, at home. And that can lead to increased burnout or decreased work-life balance.
I had to really become cognizant of, I do a lot of like waking up in the middle of the night and having an idea and not writing the email and saving it to my drafts, because that was sort of something I learned that I didn't recognize, that when you have someone who's above you sending you emails in the middle of the night a lot, or late at night, or after hours, and again, obviously there's a time for it, but it starts to feel like they're invading on you, and are you supposed to answer, and are you, really respecting other people's time, was something that I didn't kind of ever think about and learned. So I don't know, I don't know if that matters. Something interesting, I thought. Laura, too, also, I think being able to, Laura asked me, I remember OB was done, and she said, well, do you want to teach math? And I was like, oh, well, I've never really taught math for nursing, and we don't ever really do it anymore. But it was either I said yes, or I wouldn't have had a job. And I was like, sure, I'll do it. And I taught it to myself, and it came back really quick. And I was able to kind of put my own spin on it too. And Laura, as an employer, I feel like that was where you really encouraged that I had the skills to teach, all I needed was to kind of get myself into, to learn the subject a little bit more. And so you never doubted me, which was huge. And I think that's important, is don't pigeonhole yourself into something. Really think about how I had skills to teach. I knew how to teach this. I just needed to kind of go over the information a little bit more. So I appreciate that in an employer too. They can look kind of beyond maybe what you just present yourself as. That's a little more high level thinking about jobs, but
so many skills are transferable. So,
Yeah.
I mean, you're a nurse. You obviously do math every single day of your life. It's just a matter of
Right.
Really.
I'm now a math professor as well.
And that's one just to I think we show too, keep your contacts too, because you never know where you're going to be in a few years, and to be able to combine all of this in this setting, from Phoenix, reaching out to Chicago, hearing from Leah, who's been, in the Phoenix area for much longer. It's just interesting. So great conversation. I want to thank again the League of Innovation for their grant to support this conversation. I learned something. I think that's one really good takeaway is no matter what you listen to or do, there's always something new that you're going to learn. So that has been really, really good with this. And it made me realize to also remind all the students and those listening to go to our website, again, Gateway Community College, look at all the healthcare tracks and majors there. And if there's something you want to go into or something you want to stack, stacking credentials in healthcare is super important now too. You don't just need to stay in one career path, add another skill, and it's going to open up your pathway 100 different directions. So that's another thing. And I'm kind of making a plug here we have another interesting lecture, which I'm sure you can find information on our website on the Spanish flu, and that on Monday night. So take a peek at that. All this learning and information, and especially Leah, when you started us with some of the education and things, kind of made me remember it's at 6 p.m. our time, I believe.
And then 1918, that flew back then, correct?
Yes. Oh. Kind of, the correlation to today. So I think that's going to be a phenomenal history lesson, as well as kind of, what's happening now. So lots of cool things. So educate. So thank you everybody for tuning in, and this will be part of YouTube at some point, so people can go back to it, or maybe bring the portions of this into their classes, or just kind of review some of the different points that you guys made with resumes and volunteering and getting out there in the community and public health environment. So thank you both so much for adding to this conversation. We really appreciated it.
Stay healthy, wear your masks.
Yes, wear your mask.
Thank you for the opportunity. Good to see you all.
Bye.
Stay safe.
Bye. Thank you.
Bye-bye.